my dad, he had a massive heart attack, almost killed him. And he had 4 arteries that were 100% occluded. And that was a couple weeks after he had a blood lab that his doctor said, "Your labs look so good, Mr. Archibald. I wish mine were that as good as yours." You got to look deeper. And this is where it's really important to do some of these diagnostics. People who had an elite level of VO2 max, they decreased their risk of death by 400%. You can take off 20 years on your heart age just by doing this Norwegian 4x4. So this seems to be an incredibly safe and effective therapy for many things. And we're also seeing in many of our clients where we do the carotid artery scan and we're doing the cardio threat detection, we see a massive change in the overall intima media thickness. Welcome everybody to the Ageless Future. So creating your ageless future, and I'll let you guys join us here, but today we're going to be talking about the health span optimization, cardio age. How do you know how old your heart is? And one of the interesting things, if you look at the research, there is a study done on the Norwegian 4x4, and I've talked a lot about VO2 max and how important it is. One of the studies that was released, I believe it was a Journal of Cardiology in 23 or 24, what they found is that people who had an elite level of VO2 max, they decreased their risk of death by 400%. So that's pretty impressive. But the other thing, if you can get your heart healthy by doing the Norwegian 4x4, and they monitored a group of people over the course of the year, and they found that as long as they did it twice per week, these individuals had a heart that had functional improvements of a 30-year-old. So basically, you can take off 20 years on your heart age just by doing this Norwegian 4x4. So I think that's pretty impressive. So today we're going to be diving into some testing you can do for it with the ultrasound. We'll talk about what we call the cardio threat detection. And then I'll answer any questions you have. But how many of you are happy with your cardiovascular health and cardio fitness? And how many of you have ever had a setback when it comes to cardiovascular health? I think that's, I had a big wake-up call. My dad, he had a massive heart attack, almost killed him. My brother was actually at a motocross race, and my dad started to get the numbness coming down his left arm. He got short of breath, and he was 10 feet from dying. Luckily, there was an ambulance there, and they saw him. His lips are purple. And so they rushed him to the hospital, and they cracked his sternum open, and he had 4 arteries that were 100% occluded. And that was a couple weeks after he had a blood lab that his doctor said, "Your labs look so good, Mr. Archibald. I wish mine were that as good as yours." So you got to look deeper. And this is where it's really important to do some of these diagnostics. The one we'll be talking about today it's called the carotid artery intima media thickness. So we're measuring the thickness of that muscle in your big artery. The carotid arteries are what feeds the brain blood supply, which is actually really important. You do need blood to your brain. And but we'll talk about that one. There's other diagnostics where you can do like a Pronuvo scan. You can do the full body MRI, so you can see if there's any kind of arterial blockage, calcium scores, the Clearly test. These are all really important metrics, because still the heart remains number one killer in our country. So let's jump in, and then I'll finish up by talking about how you can jump into some of this zone 2 training and how valuable it can be in your overall cardiovascular approach. So let's jump into a little case study. I'll share my screen. Here we go, and it's good to see so many of you on here. We've have very fun events coming up. I just want to let you guys know when our next retreats are. We did brain health. We did heart health just last week. We had great turnout there. And the new events coming up. I don't have the dates, but it's November around, I think it's the 20th and the 21st. And then December is going to be the 18th and 19th. So it's a Thursday, Friday. I'm very close, but if you have not registered and you want to come to one of those events, I'd love to have you out at the Ageless Future Academy. Okay, so here was Victor. Victor, when we ran his heart test, we were a little bit shocked, and he wasn't, because he had actually he was 100 pounds overweight for most of his life, and heavy drinking, heavy smoking, lots of stress, and when we did his carotid artery. The goal that we're looking for is we want a thickness, this as tiny as possible. When we test like teenagers, their CIMT just looks so thin. It looks like beautiful. If you think of a pen, you have pens that have a really small font, and then you go thicker and thicker, and you go like marker. Well, the thicker it is, the more dangerous, and you can see it on the carotid artery scan. So his chronological age, he's 61 years old. When we did the longitudinal heart wellness measurement, he was 85. His thickness of his intima media was 1.084 millimeters. And remember, anything over 1 millimeter thickness, that means you've got a lot of oxidative stress, and you're putting your life at risk and having a greater probability of having plaques. The right coronary artery showed that he had 2.12 millimeter thickness plaque, heterogeneous. So that's plaque that's fairly stable, and it was 12.6% blocked. His left plaque, 1.84 millimeters is thick, so about 11.9% blockage. So nothing crazy. We've seen patients who have upwards of like 70%. We send them out, make sure it gets all taken care of. But if you think of these plaques, there's three types of plaque that can show up in these scans. One of the plaques are soft plaques, and soft plaques are where they're just barely starting to lay down their foundation in the arteries, and those are dangerous because they can get dislodged, and they can travel up into the brain, and that can cause an aneurysm. So we rarely see soft plaque. When we do, we take it very serious. We bring in a cardiologist. If you have hard plaque, that's where it's cemented in there, and it's probably not going anywhere, but that also means your blood vessels are getting brittle. You're not getting good nutrient and oxygen exchange. And then most of the time, what we see is heterogeneous plaque. And we'll talk about some solutions for getting rid of heterogeneous plaque, because there are ways of dissolving it. So one of the things that it shows is when we're looking at systemic inflammation, just by measuring the carotid artery, we can pretty much detect what's going on in all of the arteries. Now, of course, it's going to be more valuable to do like a per novo scan or something a little more systemic. But generally speaking, the carotid artery scan is global. But when you do have this thickness in the intima media, there's 5 things that it relates to. One is chronic low-grade inflammation. And you'll see this expressed in the labs as high C-reactive protein. Or oxidized LDL. You'll see your apolipoprotein B markers be higher, and you'll see your lipoprotein little a markers be high. The second thing is insulin resistance and metabolic dysfunction. So if you have your blood labs, you want to look at your fasting insulin levels. If those are above a 5, you've got a little bit of insulin resistance. Looking at your hemoglobin A1C, if that is ideally, you want it between 5.0 or maybe 4.9 to 5.4, 5.5. But once again, the reason we don't rely solely on hemoglobin A1C is because you can have blood sugar that goes too high and then too low, and it evens out because hemoglobin A1C is roughly a 90-day snapshot. It's the amount of glucose that's attached to the hemoglobin. And hemoglobin, roughly, your red blood cells survive about 90 days, and then they've done their job, and then you have stem cells from the bone marrow that releases new red blood cells. So insulin resistance. some of the symptoms of insulin resistance? Do you get hanger? Do you have like energy drops? Do you get like, a little bit short tempered if you haven't eaten? Do you get really voracious hunger? That can be a sign of insulin resistance. Skin tags can be a sign of insulin resistance. The third thing is mitochondrial damage and oxidative stress. This can show up in your blood labs in your LDH levels or lactose dehydrogenase. It can show up with your anion gap, can be kind of a precursor for what's called a cell danger response, where the mitochondria, they're not making ATP inside of the cell, they're making it outside of the cell. You can also look at your metabolomics, and there's the Oates test. It does show how well your body is moving energy down that electron transport chain. So the mitochondrial damage, that and oxidative stress, the metabolomics is the best test for that. You can measure nitric oxide levels, and there's an easy test you can do that's just like a nice little oral test that can show you the levels of nitric oxide. But nitric oxide is one of the most powerful signaling gases in the body. It allows the blood vessels to dilate. It promotes circulation. And this nitric oxide also helps support the endothelial function. So if you have any kind of oxidative damage, or imagine you have this thickness on the inner layer of your blood vessels, what that's going to do is it's going to restrict your blood vessels' ability to contract and relax. It's almost like having tired muscles. My son's running a ultra marathon again. He ran one last weekend. Actually, maybe it's two weekends ago. I was in Arizona last weekend, had a phenomenal Da Vinci 50 event, and loved it there. But the weekend before that, he and I ran a race. He ran the 50K, I ran the 25K, but he's doing another one. But he's got this, he still has some inflammation in his shins. So we're trying to work that out so that by Saturday he's good to go. But this is what happens when, same thing in your blood vessels. The muscles start getting constrained, the calves get tight. If your blood vessels aren't contracting and relaxing properly, this is where disease starts to show up. And that's why I'm so bullish on getting some of that cold exposure. Yes, that contraction and relaxation of the blood vessels are so good for you. And then the fifth thing is stress-driven cortisol. So stress is a good thing. Like we always want to be ambitious in creating this bigger future for ourselves. But when stress gets overwhelming to our body, it starts to dysregulate hormones. And cortisol is one of the major hormones that regulate stress. Two of the other hormones and that go along with that is aldosterone, which can increase your blood pressure. And then you want to also look at your testosterone, because when cortisol levels are dysregulated, you'll see testosterone start to be dysregulated with it as well. So these are really important things there. So these are important to look at when it comes to your overall health. One thing we look at is infections, because we've seen with infections, I'm sorry, I got a dog barking. We've seen with infections that that you can have even greater levels of this damage to the arteries when your body has infections. So looking at infections, you want to look at your white blood cell count. You want to look at monocytes. You want to look at neutrophils. You want to look at everything that can interfere with your body's health. We find so many patients, and I've actually heard providers say upwards of 90% of people have parasites. And so even if it doesn't show up in your stool, there could be a problem there. And so looking at monocytes, looking at eosinophils can be a big predictor as far as parasites go. The other one is low testosterone and DHEA. And the reason why testosterone is so important is because if you have lower levels, what you're going to find is that your body does not hold on to muscle as well. And the muscle is actually really important for creating this contractivity in the blood vessels. And so looking at DHEA and then looking at all your hormone profiles, especially estrogen, even for men. I know dudes were all like, oh, we need testosterone, but we do. But actually, we're finding that estradiol, or the active version of estrogen, is really important to protect the brain. Genomic instability. So when your DNA starts to unravel, and this is where some of the peptides like FOXO4 that clears out the senescent cells, a peptide called epitalin that helps with genomic instability and this telomere shortening because it's a telomerase peptide. The other things you can utilize is just the reparative peptides like BPC157, thymosin beta 4. These are some of the best peptides for nitric oxide, and they help create better vascularity. And then the lifestyle, why do our blood vessels get brittle? Well, it's lifestyle, sedentary lifestyle. You can't out peptide, you can't out hormone, out stem cell, sedentary lifestyle. Poor sleep, stress, smoking, diet, all these things interfere with our blood vessels. So what can you do? Well, there's a lot of things you can do. And, the baseline before you start bringing in interventions is, we call it the 30-30, exercising 30 minutes in the morning, ideally in the sun, and you can have your intense exercise in the morning or the afternoon, whatever you prefer. And then, 30 minutes where you're doing more of a low grade. But really, once you've got your exercise in, you're eating great foods, 25 grams of fiber. I know it sounds like, oh, fiber's, it's for old people or whatever. And it's actually really important because that fiber, feeds the bacteria in your gut, and then the bacteria in your gut influences the health of your blood. And I've talked about the microbiota transplant, and we're seeing really impressive improvements just in overall, gut motility, movement, patients with IBS, and we have just started doing it 3 months. So I don't know how it's going to translate into the blood vessels, but from the doctors who provide us the insights on microbiota transplant, they're saying that they're using it as an arterial cleansing agent. So I think that's very impressive. But some of the things you can do, some low-hanging fruit, berberine. We use GCO, that's from Cellcore. That lowers oxidized LDL. It improves endothelial health. Omega-3s, the EPA, DHEA. Had a phenomenal doctor at Da Vinci 50, Dr. Goodwin, talking about plasmalogens. And these are fatty acid structures that he's seen reversal of the brain just by using plasmalogens. And so I've been digging into those more since I heard him talk. I've heard about plasmalogens for a few years, but never really dove in. And so awesome meeting him. That could be something that helps the arteries. But what we do know on the omega-3s, the EPA, the DHA, it reduces plaque progression, stabilizes inflammation and membranes. Magnesium, the 8-hour sleep blend by Upgraded Formulas. This is great because it relaxes your whole nervous system when you go to bed. And this is a nanoized magnesium. And so it gets right into the cell versus other magnesiums can tend to be too large to really penetrate the cell wall. What you'll see with magnesium is it improves vascular tone, reduces arterial stiffness. CoQ10 or ubiquinol, 200 milligrams a day. That supports your mitochondrial function and cardiovascular energy. You can add urolithin A in with that, even some methylene blue. Beloki. This is a powerful enzyme. It's lumbrokinase. This is a peptide that comes from earthworms. And believe it or not, we use this. There's a formula in Chinese medicine called circulation sanjiao. And it's got earthworms. They were using earthworms for blood stagnation 1,000, 1,500 years ago. Pretty phenomenal. But now we've been able to isolate these active enzymes called lumbrokinase. And what that does is it dissolves blood clots. It improves circulation by breaking down the fibrin proteins and prevents cardiovascular issues while reducing inflammation and blood viscosity. Some of the more advanced therapies, exosomes. Exosomes have gotten a lot of really interesting research as of late. Initially they just saw exosomes as just some of the metabolic waste from stem cells, but then upon further investigation, what researchers realized is these exosomes are actually, they are doing the work and the signaling for stem cells. And so every time, you have a vial of stem cells, many of you have come into the office and received those. Well, there's approximately 350 billion exosomes in every vial of stem cells. And then we also use another vial of exosomes in certain cases to turn up the volume. So if we want these therapies to penetrate deeper into the tissue, to turn on different signaling pathways, this seems to be an incredibly safe and effective therapy for many things. And we're also seeing in many of our clients where we do the carotid artery scan and we're doing the cardio threat detection, we see a massive change in the overall intima media thickness. Plasma renewal. Now, we have not gotten into plasmapheresis yet. Haven't started doing the plasma exchange or the therapeutic plasma exchange. I think that's phenomenal. But what we use is umbilical cord plasma. We take out the umbilical cord blood, centrifuge it, and just take that plasma, and you can self-administer injections right at home. And the research is very compelling. We're at 82 biomarkers in one of the clinical studies. Those all improved. Patients' grim age, or their age actually started to reverse after doing this therapy. They also saw better mobility as far as some of the frailty scores. Those all improved, and it was very well tolerated. Then stem cell therapy, injected into the areas that you've had damage, or intravenously for treating the blood vessels. Some of the things that we want to focus on when it comes to your blood vessels, well, how can we align this heart, brain, and muscle axis? Because that's kind of the crux of healing, and that's where testosterone helps with all three of those. It improves your vascular function by improving your endothelial health. So you have better blood vessels, you have more receptors and more tissue that needs testosterone in your heart than your entire body combined. Testosterone can improve some of your lipid profiles by reducing LDL and cholesterol and triglycerides. So that can help stabilize and reduce arterial plaques. And then testosterone also has anti-inflammatory properties. And the best thing about testosterone is it makes effort feel good. So you can go do something and you feel like motivated to do it. Because I don't know about you, but I've had times in my life where I'm like, oh man, I just like working out. I like to feel motivated to go in there and train. And the times where I have not been as motivated are usually when I'm traveling too much, my stress is high. And sure enough, I'll test my testosterone and it's come down a little bit. So using peptides like ganadorelin and clomiphene to keep my testosterone reserves full makes a big difference. The other thing that we want to look at is the brain, because testosterone does support cognitive health. It works on the prefrontal cortex. Both men and women have these receptors in the brain. It's a dopamine modulator. So we're finding that it does regulate moods. It reduces the risk of depression. It enhances memory and spatial reasoning. So you have a little better coordination. It's neuroprotective. That means it helps reduce the risk of neurodegenerative diseases like Parkinson's, ALS, Alzheimer's, cognitive decline. So testosterone. The other thing on the muscle side is it helps with muscle mass and strength. So if you want to hold on to muscle, you need really healthy levels of testosterone. And I think that's one of the risks that we have. But the older we get, and I say aging is a gravity-fed sport, because gravity just starts zapping away all our energy and our motivation. But testosterone makes effort feel good. And it's one of those hormones where you can see the results. There's a reason why in the 90s, they made testosterone a scheduled drug. They didn't want to make it available to athletes any longer. They felt like it was a performance enhancement. While it's not necessarily a steroid, it is anabolic. Anabolic meaning it does help you build. and it helps with muscle recovery. It reduces muscle soreness, improves your performance. And then testosterone also supports bone health and helps you maintain bone density, so you reduce the risk of osteoporosis. Because one of the big risks that we all have is when we're 65, if you fall and break the head of your femur, break your hip is what they call it, because you have poor bone mineral density, your risk of death in that year increases by 50%. And so you kind of want to take a step back and say, how can I prevent any crazy accidents that would kill me? How can I create an incredibly resilient body? And having optimal levels of testosterone seems to be a great way, because it protects, once again, the blood vessels, the endothelial cell, protects your heart by calming down inflammation and oxidative stress. It protects the brain and then helps you hold on to muscle. And then testosterone is also good for libido and mood. And that's what a lot of people, they just think, I have men that I'll say, it looks like your testosterone is a little lower. And they'll instantly say, well, I have great libido. What do you mean? And it's like, well, most men, we just have great libido. Let's just face it, it's hardwired into our brain. So, but at the other side of it, there's other factors at play. And so the brain is your most important sex organ, by the way. So it can override low testosterone, but low testosterone can help in libido and overall mood, and it contributes to a better quality of life. So here's what you can do right away. We talked about some of the therapies, some of the peptides that can be really helpful, some of the causes of this plaque accumulation. One of the therapies that I did not mention is alpha GPC, so the phosphatidylcholine. And especially if you do like high levels of IV, you can do it intravenously. You can do 600 milligrams in the morning. It's great for your brain and one of the best things for your blood vessels. So you can start doing the alpha GPC right away. It's very highly concentrated phosphatidylcholine. And then on the movement side, the zone 2 cardio. Zone 2 cardio is where you're pushing yourself more than what most people realize. It's where you're kind of out of breath, and you're pushing your heart rate. Depending on your age, it's going to be 115 is going to be the lowest for those of you on here, to 130. Some of you who are younger, you're going to have to push your heart rate up into the 140s, 150s. You do that minimum of 90 minutes a week, and ideally even more. Ideally, you want to be exercising 400 to 600 minutes every single week. And what you'll see in this zone 2, you'll get better endothelial function, you'll get better nitric oxide, and you're going to show massive gains in your muscle. The resistance and HIIT training. So this is where resistance training, lift weights, and then that's what I did this morning. And then I was doing some plyometrics between, doing some lunge jumps, box jumps in between my lifts, and that activates the mitochondria, and it helps balance out the oxidative stress. And then to recover, you want to just watch your heart rate variability. So if you're not using a sleep tracker, I would definitely recommend it, because these sleep trackers can let you know the health of your sleep, lets you know your heart rate variability. Ideally, you want it to be stable. We do want the heart rate variability to be a bit higher, but there's no perfect HRV, by the way. Sometimes higher, we say it's better, but higher HRV, we've also seen that's where there can be an immune attack. So if your HRV jumps too high, and if there's no other inputs, you want to figure out why. But that heart rate variability is basically showing us the amount of contractility and relaxation in the heart. Look at magnesium and glycine. That's great for sleep. Practice the 3-2-1 method. Stop eating 3 hours before you go to bed. Stop drinking fluids 2 hours before you go to bed. And then turn off the news and screen time an hour before you go to bed. That alone, that mindfulness, your quality of life will just improve just by doing that. So some of the things, think months 1 through 3. We're going inflammation reset. We're going to be working on mitochondrial ignition, hormone and lipid balance. This is where we'll use BPC, thymosin beta-4 frag, sarcotropin, MOD-SC, NAD for the mitochondria, tesofensin, thymosin alpha-1, epitalin. Months 4 through 8, think growth hormone axis and detoxification. That's where we'd use like tesamorelin and some of the gut peptides. Those could be like KPV, lorazepam. We're looking at cardiometabolic acceleration with BPC, TB500, even ARA 290, SLOOP 332, and then that neurovascular reset. So get that cognitive capabilities going with CMAX and Selenk or cerebral lysin. Cerebral lysin is phenomenal peptide doing it intravenously. Months 9 through 12 is the cardiac remodeling support. So IGF-1, LR3, very robust growth hormone stimulation. DNA repair through epitalin, DSIP, GHK, NAD, and then the longevity and stress reset. So that's longevity and stress reset is really important because this is where you can use like FOXO4 and stacking BPC 157 with thymosin beta 4. It resets your HPA axis and then it clears out those senescent cells. So there's some phenomenal things you can do to jump in and just really start measuring yourself. So big targets, with Victor here, cardiovascular age, he was 61, he's 85. We wanted to get that carotid artery intima media down below that 1 millimeter reference range, get it down to 0.9, remove the plaque burden by 20 to 30%, reduce the pain. So these checkpoints, the carotid artery scan, you can do that every 3 to 6 months. It's a very fast test. And that's where you're going to see a very robust, healthy lifespan. So I know I covered a lot today. And so for those of you who have questions, happy to take your questions. Appreciate you guys being on here. But how many of you are like thinking about your blood vessels now? And hopefully you've got a few ideas. And good. And I hope that you guys are actually looking at considering how much fiber are you eating? My son the other day, he's counting all his protein macros, and my wife's like, "Oh, you've got beans. There's some beans. They have lots of protein and lots of fiber." And he's like, "What's fiber?" I was like, "Oh, wow." He didn't realize, he didn't know what fiber was. So there's soluble, there's insoluble fiber. And this is the material, it's like cellulose basically, that holds the plants together, and that fiber is what the bacteria feast on, and it's like a scrub brush for your arteries, scrub brush for your gut. You get good bowel movements. It's like feeding the healthy critters that we're all in this symbiotic relationship with. So, well, I appreciate you guys and hope you enjoyed that. And I will see you on the next Ageless Future Creation session. And we'll talk soon. Bye-bye.